Good. All right. Ready?
Feel it.
Hello, everyone out there in the YouTube universe. I am Craig the Chiropractor, and today we are treating Mary. She is a student and an avid runner, and she's having some lower back pain, knee pain, so we're going to get right into this and help her out. Mary, do you have any pain typically when you're sitting like this?
I do in my lower back.
Okay. Does this, when I push in your back like that, does that help
It
the
does
back
help.
pain? Okay, great. And a lot of times when you're not running, you're not working out, you're sitting in a class because you're studying finance right now. Okay. So often when we get patients and they're sitting for long periods of time, it's you could have from due to the sitting, you can have the back pain. It's really common. So you might want to look into periodically just arching your back, bringing it back like that. That could be helpful. Okay. But we're going to do an assessment right now, and we're going to check out some other things. Mary, do you have any pain right now when you're standing?
Lower back.
Lower back. Okay.
Yeah.
So what I'm going to have you do is I'm going to have you do a few movements, and I'm going to ask you during the movement if you're having an increase in pain or if there's a decrease in pain, let me know. And then after the movement, I want to know, did it get better or is it worse? Okay. So for the first one here, just bending forward like that. Okay, I'm going to have you do that. Bend forward one time. Great. And let's have you come back up. Good. Any pain with that movement?
Yes, when I lean down.
Okay, when you lean down. Okay. All right. Now, what about when you go backwards?
Not too bad.
Okay, good. All right. What about when you go with your hips off to the side?
No pain.
When you go hips like that? Okay. All right. So what we're going to do now is some repetitive movements. We're going to have you do 10 times. I'm going to have you bending to the floor just like how you were before.
Okay.
Good. Okay. Great. Great. Any increasing in pain as you're doing this more?
I do feel an increase in the lower back.
A little bit more. Okay. Is the pain going down the leg or anything, or is it just staying in that one spot?
Staying in that one spot. On both sides of my back and my lower back.
Okay. All right. You can stop right now. That'll be fine. Now, what about, let's do some repetitive extension.
Not too bad.
Okay. No increase. Or what
I
about any
feel a
decrease?
relief when I go back like this.
So it helps relieve the
Yeah.
pain. Okay, great. So now we're going to do some other movement. When you're laying down, I'm going to have you bring your knees up like this. And I'm going to have you do that 10 times. And then I want to see if there's any changes.
So knees to the chest?
Yep.
All right.
Okay. Good. And you can put your hands over your kneecap. Yeah. In like that. Good. Any changes?
In my lower back, it does feel better when I'm like stretching it out like
Stretching
this.
it like
yeah.
that. Okay.
I usually don't stretch. It's just.
Yeah. Absolutely. Warming up the body is really important before you run.
Mm-hmm.
And we'll show you some stretches that would be really helpful for you to do before you run as well.
And this is shooting for the lower back?
Yeah, what we're wanting to see if these movements are either increasing the pain, decreasing the pain, having any effect at all. Okay? All right. Great. All right. So now, after we've done that, has it helped a little bit or is it the same?
I would
better,
say
worse?
leaning back and bring the knees to my chest has helped.
Okay, so now we're going to do another movement. Okay,
Okay.
this is called the press up. And this movement, you're going to lay on your stomach and you're going to put your hands here and you're going to do, they call this in yoga, the cobra. Okay, have you ever done yoga?
No, I haven't
Okay.
done it yet.
So you're going to put your hands kind of off to the side.
Okay.
Yep, perfect. And you're going to lay down on your stomach. Good. And what you're going to do is you're going to press up. You're going to leave your lower body on the table on your stomach.
Okay.
And you're going to bring, yes, just like that. I'm going to have you do that.
Like a little push-up.
Yeah, exactly. And just relax your legs. And I want to know, too, is this affecting your lower back in any way?
I feel it when I do this.
Now, Is it increasing the pain or?
I would say when I do this motion, yeah, I do feel the pain more.
Okay, you feel the pain a little bit more. Okay. All right. Okay, good. All right, so now what we're gonna do, I'm gonna do a couple of other things. You lay on your side this way. All right, good. Bend this leg. All right, great. And, wow. Okay, did you hear that? Awesome. What I'm gonna have you do is actually go on the other side of the table. Split. All right. Awesome. All right. All right. Good. This way. Great. Great. Okay. Got a little bit more. I'm gonna have you lay on your back. Very good. Gonna adjust the mid back area. This right here. All right. Breathe in and awesome. Very good. So, a lot of people that are studying in class a lot, they're sitting, they will have a lot of tension between their shoulders. They're at a computer, their shoulders are like this, they're in that movement. So that area that we just adjusted helps with that. And with your back, I think because you're in school a lot or you're studying, sitting is the worst thing.
Yeah.
It's the worst thing for your back. And when you do sit, it's important to have proper seating position and making sure you have that arch in your back.
Mm-hmm.
So that's what will also show you some things that would be very helpful for you to do that. Good. Good. All right. All right, so I'm going to put this around here like this. So what we're going to do is we're going to traction your neck a little bit here. I'm going to have you just bite down on your, just right there. And all right, good, got it. All right, awesome. I'm just going to have you lay down right there. I'm going to check some other things out. Any change when I'm doing this?
When you bring the knee back.
When I bring the knee back. Do you feel it more or do you feel
I
like
feel it less. It
relief?
feels better.
So what got you into running? Was there somebody that like
Yes, there was a man named David Goggins. He got me into running.
Awesome.
He's a motivational speaker and he's a runner.
Wow.
So hearing him got me into it and I fell in love.
That's awesome.
I did start doing it every single day.
Okay.
And started doing it with little by little at first. My body wasn't used to running like that because I go to the gym every single day.
Mm-hmm.
But that's weight training.
Right.
Not running, not cardio.
Right.
And over time, I just got better and better.
That's awesome. And how long do you run for?
I'd say an hour every day.
An hour.
Yeah.
That's awesome. Great. And in Florida, it's tough too because it gets so hot down here. I mean, do you run early in the morning or you
I
run
run
at night?
in the afternoon now because it was too hot in the day.
Oh my gosh. Okay. Right. Any change when I'm doing that? Or not as much?
That's with my hamstrings.
Okay. So yeah, I was feeling that when we're lifting your leg up, feeling your hamstrings are tight and you're wanting to bend your knees. It's definitely a sign of tightness in your hamstrings. So it's really important when we're running to have some flexibility in the muscles the hamstrings and the quads especially. And I noticed here in your quads that the quads are really tight too. So we're going to do some deep tissue work on your quads to help loosen them up and on your hamstrings to help them relax so you can do better with your running and you won't have as much knee pain. All right. So we're going to work on these muscles in here. This.
I'm excited for this
one. Yeah. Yeah, knee pain is
not
no fun when you're trying to run.
Especially going to the gym, hitting legs, I feel it. And then I go on my runs, I'm like, oh.
Okay, I'm gonna have you bring your leg up and then I'm gonna have you bring your leg down, okay? Ready, and bring it up and down. Good, and 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 up and down. Good, just relax. I'm gonna do a little bit more in this area. Good. And we're gonna do the other side too, because I don't want you running lopsided. I mean, we gotta fix both sides.
The next one wasn't that bad. I was always so intimidated by it.
So this was your first adjustment, right?
Yeah, this was my first adjustment, and I was always very timid about the neck.
Yeah.
But that's where I feel the most pain, especially as a college student, when I'm reading, writing, my head's always down, or just being on my phone.
Yeah, I think cell phones have really helped our business a lot because everybody's on their phone and like all the time, and it's creating a lot of neck pain, which is bringing people to me.
That's so funny.
All right, one more. Good. Awesome. Good. Okay. So, a lot of people that run have a common complaint. They get some tension in the side part of their leg called the IT band right in here. Okay. We're going to work a little bit on that. I'm going to have you lay on your side. All right. You can face that way. Perfect. And we're going to do a little bit. Bend. You could bend your knees. Yep. Perfect. And what we're going to do is work on this area. If it's too much pressure, you let me know.
You got it.
Good. So, and especially if you have back pain, what ends up happening sometimes is that patients will run a little bit to this, they'll run straight, right? But they'll slightly put
tilt.
A little bit more pressure, right, tilt to the other side. And that will cause these muscles to have to do a little bit more work, and they'll get overworked, and that will cause
That's what's
that.
happening to me. I'm noticing it.
All right. I'm going to have you bend this leg up like that. Good. And just bring it down. Yeah, there we go. And up and down. Good. And up and down.
That feels great.
Good. And up and down. Good. And up and down. Good. You gotta also remember to drink a lot of water when you're running. It's so hot. I mean, summer is here now, and I can't believe it. It's just like
The heat is crazy.
Yeah, we went from like a spring, which was a few weeks, to now it's summer's here. So a lot of times when people they dehydrate, their muscles will cramp up too, and if you're outside, you gotta really drink a lot more water than most people think. So we're gonna have you bring this one up too, and down. Good, and up.
That's so interesting. So
And
less
down.
water, more cramps.
Yeah, so if you dehydrate, you'll cramp up. So before you run, you should drink a lot of water, at least 8 to 10 ounces of water.
That's good to know.
Yeah.
Sometimes you have to take the breaks because the heat's so much.
Yeah, I know. I know. 1 second. So we're going to use a spinal cord massager here through the hamstrings. You okay? Good.
That's good.
So this helps with tight muscles that have tightened up, or you have strained muscles, and there's possibly lactic acid buildup. And like we use this in the calf too, right here.
I'll get very sore in my calves because of running.
Yeah.
That's a big one.
What kind of running shoes do you use?
I use Adidas, just Adidas running shoes. I love them. They're memory foams. So it's
Great.
Feels like I'm running on pillows.
Awesome. So I'm gonna have you sit up right over here. We're gonna do a couple of acupuncture points that are related to knee pain. We're gonna be doing points here, 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 and behind the knee, and one on top right over here.
Okay.
All right. Ready?
That's nothing.
Yeah.
I don't even feel it.
Yeah, it's a lot of people have fear of acupuncture. They think that it's going to be a needle that they use when they're drawing blood from, they're doing venipuncture. The gauge of these needles is so thin that you hardly feel it. So it's really not that
painless.
Yeah, it's really not that painful. And I think it's a good adjunct to the treatments that we do. here in the office. And it's something that I found in my office helps patients, and it's doesn't have the side effects that a lot of other medications have, drugs have. So it's so it's natural, and it's something that we could try first if somebody's having some knee pain.
Is it only for the knees, or can you put it in other spots?
Actually, there's a lot of different conditions that acupuncture helps. In my particular practice, good, and relax, good, right there. In my particular practice, we use acupuncture in helping treat knee pain, shoulder pain, neck pain, back pain. So we do that, and headaches too. It could be really helpful in headaches.
That's good to know.
Yeah, there are hundreds of conditions that acupuncture can help. In my practice, we pretty much use it to treat those particular conditions. So we're going to do a couple of ear points in the ear. We're going to do one for just general pain. There.
So how does that help?
So there are systems in the body that are little, like mini acupuncture systems. In the ear, in the hand, in the scalp, in the tongue, in the foot. So there's different areas where there are mini systems, and you can use those systems and apply the points, the pressure to the points in those areas, and it can have an effect in another area as well. So we're doing some treatment in the knee, and then also some distal points in the ear that also can affect as well. All right?
All right.
We're going to review with Mary a couple of stretches that are going to help you to limber up your hamstrings, your quads, and your calves, so you can get more out of your running and reduce the risk of injury, okay? All right, so the first one we're going to do is in a seated position. You could do this on a bed, or you could do this on any kind of a table. You're going to be sitting down, you're going to be putting a towel around your foot, and you're going to be holding the towel, straight knee, and what you're going to do is just lean forward slightly, awesome, and you'll feel that in your hamstrings, and you do that for a period of 10 repetitions, which is great. You're doing a great job.
Really feel a stretch.
And we can also, in this position, stretch the calves too by just bringing the toes forward towards you. Bring the toes forward, kind of curl them this way, and then just slightly lean. Perfect, great. And you can do that where you're getting the hamstring and the calf as well. If we emphasize bringing the toes back, we're going to get a little bit more of the calf stretch. So that's two of those stretches that we're going to do. The next stretch that we're going to do for the hamstring is we're going to be laying down on the bed or a table or a yoga mat. I'm going to have you laying down, and I want you to bring this leg up and your hand underneath the knee, and we're going to start with you bending the knee. We're going to start in the bending position, and we're going to have you extend. Okay, bring this out, and what we want to try to do is hold behind the knee, hold behind your knee, and what we want you to try to do is straighten out your knee. Now, if you can't straighten your knee, that means your knee's up a little too high, and just bring the leg down a little bit more. Try to grab, make sure that you're still holding your thigh, and then straighten it out. You feel that?
Yeah.
Okay. All right, great. So that's also a hamstring stretch as well. We would recommend you do this for these 10 repetitions. And again, too, you could straighten the knee like you were, and you could also just bring it forward like that. All right? Excellent.
All right.
The next one that we're going to do is we're going to be stretching the quadriceps, because it's really important that we don't have tight quads when we're running. We're going to have you face down on your stomach, and we're going to bend your leg, all right, all right, towards your glutes, and you're going to bring your hand back like that, and yes, okay, yes, do you feel that a little bit? Okay, and sometimes you can even use the other leg too, the other hand too, to bring, great, just like that. That's exactly what we're talking about. That's great, awesome. Hold it for a couple of seconds, and that's a hamstring stretch, a quadricep stretch that I want you to do before you're doing your running as well. Okay, great. Another calf stretch that you can do if you're having calf problems is in a in a door jamb here like this, you could take your foot like this and try to get your heel, this part of your heel, as close to the door frame as possible, and try to keep your foot straight and then lean into it a little bit. Try that. So what you'll do, so what you'll do is bring this heel as close to this as possible, and then try to bring this up without, like this, down like that, okay? And then lean this way a little bit. You feel that?
Yeah.
All through here. Okay, good. So that's another way you could try to stretch your calf as well. With calf pain, we also want to make sure that the sneakers are tight enough when you're running, and we want to make sure that your foot is not moving around in the shoe a lot. So they do have socks at running stores, running stores that will have kind of like a rougher texture on the bottom of the sock, which will prevent your foot from sliding in the shoe when you're running, because you don't want a lot of slide in the shoe when you're running. That's going to cause blisters, and it's going to also cause strain of different muscles that you use. Okay, so the last thing that we're going to work on with Mary today is we're going to work on the foam roller. We're going to do some rolling out quads, hamstrings, calves, and we're going to show you guys how to do that. All right, great. And you've been awesome. And if there's anything you want to add or anything, whatever, just say, hey, this this is great, or whatever, just feel free,
Will do.
All right. So the other thing that we forgot about making sure that we're stretching out, or at least engaging, is the IT band. And the IT band is something that gets strained a lot in runners. Usually runners will have cramps on the side of their thigh. So Mary's going to show us how to use the roller and to self-treat the area along your thigh. And what we're going to do is have her laying on her side and using the roller to knead out some of those rough parts.
Feel the pressure.
Yeah. Knead out and trying to get rid of some of those tight spots in the IT band.
That gives so much relief.
Yeah, it's good.
Mm-hmm.
All right.
So is this for after runs or before runs? What would you recommend?
You know what? You can do it both. I think it would be more important to do it before the run, just to kind of get the blood flowing to the muscles and to loosen up. So before the run, we want to make sure that you do the stretches that we just discussed, and you demoed, and then we want to do this. And then when we do our running, the first few minutes of the run, we want to take it easy and gradually get into our run so we're warmed up. All right. So now we're going to use the roller for the hamstrings and then the calf. Okay. So we're going to have one leg kind of off to the side a little bit, and we're going to be kind of going back. Great. Like that. For the hamstrings. You feel that?
Mm-hmm.
That's good.
Feels very good.
And then we're going to have you going down a little lower for the calf.
The calves is where I feel the most as a runner.
Yeah.
And wow.
Yeah, they take
That's insane.
Yeah, it's really important to do this so you can be able to recover, and you're going to reduce the risk of injury, and you're going to run better too, as well if the muscles are more loosened up and warmed up properly. Great. Awesome. And now what we're going to do is Mary's going to demo the quadriceps. She's going to use the roller to help.
So how do I do this one? This one really...
Yeah, just one leg off to the side.
Okay.
And then what you're going to do is just go up like that and try to get as much weight on it as you can. Yeah, there you go.
Oh, wow.
There you go. And what you'll do is you'll kind of move your body in a way to get...
Feel the pressure.
To feel the pressure on those areas that are tight.
Oh, that's my whole thigh then.
Yeah. Awesome.
All right.
So that's the quadricep. And there's 2 other ways that I recommend my patients use these, especially for the back. And just as it's a general stretch, is one is laying on this kind of like this, and kind of just going back and forth. I'm gonna have Mary demo this in a second here, like that. This just helps open up, your whole thoracic, and helps to loosen up your.
So are you just laying on it, or you're teetering kind of like?
Yeah, kind of teeter back and forth. You put your arms out to the side, and that's a really good one. You can use that foam roller as well.
And my lower spine or no?
Yeah, you kind of just like lay on it.
Okay.
And you're putting your arms out to the side, and you put your hands on the floor, and you're just kind of rocking back and forth, just gently, just any areas that you're feeling tight. You could put your hands on the ground just to kind of give you some balance and support, and you can relax your head back like that. Can you feel that?
Yeah.
Good. So that's one other way. And the other way would be laying on your back and starting up with the roller in the mid back, and then rolling down, up and down your back.
So if I were to do that, would I go horizontal?
Yeah, I'll show you. So you turn this way.
Alrighty.
Yep, turn this way. And you're going to start with it. Yes, right there.
Yep.
And then what you want to do is bend your knees, and then just relax your neck and everything, and then let the roller go all the way down by the ribs.
Oh wow, I feel great.
Yeah. Okay. So this is also really good to help areas of the back. Either if some of the segments in your back are not moving that well, this is a very good way to help improve mobility in the spine, in the mid back. And this is a good way also if you're having muscle tightness in your back. If you're sitting hunched over a lot,
That's me as a college student.
Yeah, you're a college student, you're doing that. This is helpful to kind of work some of the knots out that accumulate when you're doing that forward sitting position like that and doing a lot of computer work. So awesome. Mary, awesome.
Thank you so much.
Thank you for coming down and being treated today. Your first chiropractic adjustment. I feel honored. You're awesome. I think you're going to do great and continue your running and in school. And if you guys enjoyed the video, share it and click the like button and subscribe.